How's it going, friends? My name is Jesse. Welcome back to Male Nurse Mentor. You guys saw the title, the thumbnail. This is Reddit reaction videos from a nurse. And today we're doing the nursing student subreddit. See what we can find. Don't listen to anyone. Nursing is the best major. Let's just start with this one. For those who want to change or drop, don't listen to naysayers. Nursing is the best major ever. Honestly, I agree. I know I'm biased, but for the time invested, the work-life balance that you get, the job stability, just the level of career advancement opportunities, it's not a perfect career, but when you're looking at 2025 and your opportunities that exist when you actually go to school for a degree and then you try to use that degree to survive in this life, there aren't many great options, unfortunately. Nursing is one of them. You know, my advice if and when you become a nurse is look for a good pocket. There are good pockets that exist. A lot of people naturally want to gravitate towards the hospital. Just know if nursing is calling to you, you have an interest in nursing as a career, but you're not interested in the hospital, you don't have to go into the hospital. I am always very transparent with, my viewing audience. I never worked in a hospital, but regardless of that choice, it may have seemed risky at the beginning, it didn't cost me where I am today. I still get to work from home, which a lot of nurses would love. And honestly, I have loved ever since I've been in this position and when I first found out about it, right? That it was a possibility that nurses can work from home. Really, honestly, as a major, as a career choice, I agree. Hi everyone, incoming nursing freshman here, excited and a bit nervous for nursing school. Looking for tips on study habits, time management, apps, books, tools to prepare. Thanks in advance. I think in order to get to nursing school, I'm assuming this is nursing freshman in college, maybe from high school. The biggest tip I can give you, right, to prepare for a nursing program is throughout the prerequisite process is find out your study style. It's gonna take some time to adjust to the college setting, right? High school was high school, but when you get to college, it's just gonna be different. A lot of autonomy compared to high school, a lot of freedom. No one's really gonna be watching over you in the ways that you were watched in high school. The grades are gonna be dependent on how serious you are, right? When you're in college, you're gonna see a lot of people slack off naturally. And if you really wanna be a nurse, get into a nursing program, you can't slack off. You genuinely have to be one of those A students to easily get into a nursing program nowadays. Otherwise, you're gonna struggle. And even then, you can struggle depending on the program, right? Some programs are lottery, so once you hit the threshold to apply, it's just a waiting game, and that's a struggle. So be patient, take time to actually find your study style, really hone in on that. I can't stress that part enough. When it comes to time management, when you're knocking out your prereqs, time management's gonna have to be a priority. Again, it ties into finding your study style, putting in the time to study. I always, right off the bat, designated weekend days, Saturday, Sunday for study. And I didn't really have a life, especially when it came to anatomy, physiology, microbiology, chemistry, statistics. When it comes to those classes, you have to take them very seriously. And your work or your life and social life balance, it becomes imbalanced, right? So just continue to pour in energy, pour in that time commitment to your weekends specifically, and probably in your afternoons too. As far as any apps, Quizlet is always a great one to use. That's for a prerequisite nursing student, like a pre-nursing student. Once you're in nursing school, the best advice I can give you is in that time that you've taken as a pre-nursing student, I would have hoped that because it's 2.5 years, you would have now found your study style. You just continue that study style in your nursing program. That study style hopefully got you the grades to get in, right? So it's effective, right? The idea is it's an effective study style for you. If you have gotten into the nursing program and you haven't found your study style, and study styles can be, reading from the book, reading from PowerPoints, going to the coffee shop where there's a little bit of noise, studying in a quiet room, in your room at home, no music, with music, in a library. Those are things that I mean when it comes to study style. So just continue that into nursing school. I've always mentioned it in videos from time to time. I personally think nursing, the pre-nursing phase is harder than nursing school because of the pressure on each class. In the pre-nursing phase, you're really trying to get those A's, right? That's a priority. In nursing school, you're trying to pass and learn the information, right? And saturate your mind with knowledge. And the grade is second to that, right? As long as you learn and can decently pass a nursing program, that's what matters. In a pre-nursing phase and those prerequisites, the grade is what matters. Sometimes I get 80%, sometimes 90%, sometimes hitting 70%. But I just want a constant good grade from 90%. Am I doing something wrong? Just hone in on that study style, try different things. That's honestly my biggest advice, because there's so much you can do in that, right? And don't follow what everyone else is doing. Naturally, when I got to college, I wanted to naturally go and study with groups and study with my classmates, right? In these hard science courses. I realized that that wasn't benefiting me. I actually didn't do well early on when I was trying to do that. So what I would do instead is I would lone wolf myself, go study at home, study on my own in the library, things like that. And then when I felt comfortable, saturated for the test, ready, I would then go and study with classmates and kind of just pick each other's brains at that point. And that was a much more effective study style for me. And just to give you guys an example, I was very much PowerPoints, reading the book type of person, and more so PowerPoints if they were there. The PowerPoints, when a professor gives you PowerPoints, look at it as just key information that is going to be, or potentially be, picked from to be on the test, right? PowerPoint information. They're not showing you something on the slide that isn't fair game to be on the test. When you get a book, overwhelming, right? Pages upon pages, endless amount of pages to sift through. When you get a PowerPoint presentation, it's very specific, chosen information. Take those pieces and study those, right? And then you can go to the book and study a little bit more on those specific things. That's my style. With 60% in most of my nursing work, how screwed am I? With 60%, oh, like you got 60% grades? You're probably not gonna make it, right? I'm just being blunt with this person. You're not gonna make it. Like 60% is a D. You can make it, you know, if you go and retake all your classes and somehow pull yourself out of that position, but that's gonna take a lot of upfront work. 60%, that's pretty much, I don't even know if that's even good enough for like a prior program that can be very generous with you. So that's a tough position. Really try to avoid being in that position if you can. That's the only way, because once you're there, you like someone like that probably has to choose a different degree, or they have to go and start as a CNA, you know, maybe go into an LVN vocational program that the requirements are lower, work as an LVN for a bit, do the bridge, right? Find those nursing programs, because they do exist, right? The ones that where you can go from an LVN to an RN, an ADN RN, and then once you're an ADN RN, you've made it, right? So there's ways to work around this, but yeah, it's not easy. It gets harder when you shoot yourself in the foot like that. Does anyone know how to study effectively in nursing school? All throughout my prereqs, let's see, I'll click on this one. All throughout my prereqs, it's been easy to study, to memorize and understand the concept, but in nursing school, it's completely different. Let's see, you struggle with the application of the knowledge. The best advice I can give this person, if you struggle with the application of the knowledge, it makes sense. Well, first off, I'll acknowledge that makes sense then why you're struggling with nursing school. Because nursing school, it's a foundation continuing to be built on everything you've learned, right? So you take all those prereqs that you've learned, right? All that information of anatomy, physiology, microbiology, you take all those pieces and then you get more advanced physiology, nursing related physiology, right? When you're in nursing school, but it continues to build upon itself. The best thing I would say is maybe read. I see you're already like rewriting notes and, you know, using the whiteboard strategy. So you're really trying to get it like ingrained in your mind, and that makes sense to me. That's really the best advice. I think you're doing the right thing. It's just a matter of continuing to do that and just be patient with yourself. You're just going to have to try to really force that information in, and hopefully you retain it. And if not, really just write notes for yourself, you know. One thing I hope to at least take some burden off you, right, this person, is when you become an actual nurse in the field, all that information that you learn in nursing school, you're not going to use it all, right? It all goes somewhere, right? You keep a little bit, but you only use some of it, right? You don't even use most of it, especially dependent in which specialty you're in, right? Nursing school blitzes you with all this information up front, very overwhelming. And when I realized when I became a nurse, I didn't use most of it. It's good to know, and I would say depending on the specialty, right? Like if you're in ICU, you want to know all this stuff. Some of the most informed nurses are ICU nurses because they have to be. They are very well educated, very well informed on physiology, right? Because they have to kind of read the signs that the body's presenting and kind of understand almost at all times what's going on, what can potentially happen. Just keep that in mind. You know, nursing school is supposed to blitz you with all this information, and it's okay if you can't retain it all. And again, like I mentioned in my prior points, it's okay if you don't get those A's in nursing school class tests. It's okay to get B's. It's okay to get a C every once in a while. And I know that concept is a hard one to just accept, because to get into a nursing program, you've been an A student the whole time, right? Practically, if not actually, right? And then to go into a nursing program and start getting B's and C's, like that could be demoralizing, and I get that. So that's what I would have to say to this person. How broad is nursing? Is the burnout experience in nursing caused by the nursing major being large? I would say overall, no. That's not a reason the burnout happens. That's a reason you can avoid burnout. So because the field is so broad, sure, it's like it could be a burnout initially when you're like, oh, where do I work? There's so many places to work. But the burnout happens because you're in a setting that you no longer enjoy, or you go into a setting you've never have wanted to work in, and you know, management continues to add on top of this things with personal life, coworkers, patients. The best advice I can give you to avoid burnout, I've mentioned it before in some of my videos, is learning how to say no. It's a hard thing to do, but at some point in your career, you're gonna have to learn how to say no. No to management giving you a position, a rotation, a set of patients that you don't feel comfortable with. Saying no to possible overtime that they're offering, which may be enticing. And then that, in addition to choosing a specialty that you like, right? A setting that you enjoy, that you're interested in. Don't go into an area that you have no interest in. If you do want to be in a hospital in a specific floor, you may have to do some time in a setting you're not really interested in. But again, you're looking at the bigger picture, and you should lean into that bigger picture, right? Like if you want to be an ICU nurse, but you got to start in med surg and you're like, I hate med surg. Well, just remind yourself why you're doing med surg, right? To continue to get some hospital experience. Yeah, I mean, it's a good question. I've never really heard of, you know, burnout from the nursing specialty being so large. Let's see this one. This one's a pretty common one too. Is taking CNA before ADN, BSN. Hello, is it worth it if I take up a CNA program before proceeding with an ADN or BSN program? Is it worth it? I mean, if you have the time, if you have the mental bandwidth, the capacity to, you know, take and complete your prereqs and add being like a CNA student to that mix, it's worth it. But that's also a big commitment. It's not easy. For me, I actually did go to become a CNA after I was pretty much done with my core prereqs, and I didn't get into a nursing program the first time I applied. So I had some free mental bandwidth, had some energy, and you know, during that winter break, going into like the spring semester that I didn't get in, I had some time, right? So for me, it made sense. I was going to become a CNA, never got actually certified, because by the time I was done with that program, I found out I got into the fall, right, nursing program that I applied to. But that's an example of it being worth it, because if you don't get into a nursing school, what else do you do? Well, a CNA, being a CNA, getting some hands-on experience, getting some confidence, some exposure, it is worth it. Is it necessary? Is it something you have to do? No, you don't have to. So just sit with yourself for this person and decide if you have the energy, the bandwidth, the desire, the time, right, to pursue that, because it is worth it if you have all those things. But just remind yourself it's not something you have to do, and it's okay if you don't have any CNA experience before nursing school. Career change advice. Let's see. These are like the ones I normally deal with when people reach out. So I'll end with this one. Career change advice from scientific sales to nursing, early 30s, SoCal. Hi everyone. I'm looking for a bit of advice from current or aspiring nurses. I'm in my early 30s and currently working in scientific sales, selling it to big pharma, academia across the US. I've had a successful run, but deep down I've known for a while that this isn't what I want to do long term. It pays well, I'm successful, but I don't feel fulfilled. Lately, I've been seriously considering going back to school for nursing. I graduated about 10 years ago with a science degree, but I wasn't the strongest student at the time. The advice I can give you, a lot of people reach out to me with this specific type of scenario. This person's already like in the career, in the workforce, they're a career changer, and it sounds like they have a good, stable life. They're just not feeling fulfilled from a job that they currently do. For this person, I would say an advanced BSN is probably a smart choice if you have the funds for it. And I said advanced, I mean accelerated for the ABSN. I know public schools have them, but with that GPA, there's a high chance you probably won't get in because it's a public school. And if you're hinging everything on the fact that you have to get A's and you're starting with a 2.8, I think you can apply. It just depends on how competitive you are. Just like we all have experienced, right? Going into a public school, even though it's a non-accelerated program, just a normal one, we feel the competition and it's fierce, right? It's gonna be tough. I would say for this person, you would have to be okay with a time block commitment. Like, sit with yourself and genuinely, honestly, how much time would you give yourself to fulfill this goal? Because it's gonna take time to get those prereqs. It's gonna take time in your life to try to get A's in those prereqs. If your GPA isn't where you want it, are you willing to go through that adversity, right? Face that setback if it's actually there and realize your GPA isn't good enough to get you in. What happens then? Are you still okay going back to scientific sales? Does your life drop off? Do you have personal life, like family obligations? Do you have kids? There's a lot that goes into this. That's why I say when people are making a career change, one of the easiest things you can do to alleviate some of these unknowns is you go and pay for it in a private program. But it can be very costly, right? Especially if you want an accelerated private nursing school program. It can be costly. So if I was talking to this person, the very first thing I would say is really check in with yourself. Okay, you want to do this? What's the timeline that you would give yourself? How many years are you okay with sacrificing in a sense? And in that time frame, right? Let's say they give me a number. If at the very end you don't get in, how would that feel to you? Where would you go from there? Would you be okay with splurging? Hey, I've already made it this far. I'm just going to go ahead and just pay for a private program. Okay, well, that's the pathway to become a nurse. Or are you willing to then extend another year and then another year, right? To maybe retake classes, maybe change your route, right? Become an LVN instead. If you're able to change and pivot down this path, what that tells me is you really want to do this, right? You really want to become a nurse. If you tell me, no, I'm just going to give it 4 years, and if I don't get in, I won't do it anymore in my life. That's also an option too. But I need this person, right? If I'm speaking to them, I would need that person to come to that conclusion, right? Career changing into a nursing career, you have to have a lot of grit. There's a lot of adversity there. There's a lot of hard truths. So that's what I would say to this person. Anyways, friends, that's going to be it for today's video. I enjoy making these videos. If you enjoy these, continue to hit the like button. Maybe I will continue to make these Reddit reaction videos. I think they're useful. It's a great way for me to just give a lot of advice and mentorship. I'm always around if you need me. I have a website, californiaprenursing.com. I also have my Instagram. Follow me, send me a DM, reach out, know where to find me now. See you on the next video. All right. Just as an update, I did respond to this person. You know, I had to. So there it is, right there, if you're wondering. There, I had to. I feel better now. I scratched my forehead.